Welcome to the Sunrise training video for Unit Clerks at Jefferson Northeast. Sunrise is the current clinical electronic medical record used for all inpatients as well as ER patients. Access Sunrise via the desktop icon labeled Sunrise 16.3. In the current list menu, you'll have options for Bucks campus, Frankfurt campus, and Charsdale campus. We are currently on Frankfurt 5 East. This unit has 31 visits or 31 patients right now. Single click any patient. Their name appears at the top of the screen. This is called the patient header. You can see your patient's location, admission date, height, weight, allergies, attending physician, ID or medical record number, followed by their visit or AR number, age, date of birth, and gender. The patient list tab is selected by default. This tab can be customized. These columns can be added or removed and can be resized and moved around. To add or remove any columns to this list, icon select visit list column. On the left are the columns that are available. If I wanted to add age, I would highlight and add. And on the right are the currently displayed columns. If I want to remove a column, highlight and remove. Some basic columns here are the patient's location, the patient's name, admission date and time. If a patient has Medicare insurance, there will be a flag in this column. Any patient with a discharge order would have a flag in this column. Visit reason, provider. Any patient admitted to the hospitalist group, the hospitalist name will be listed here. Accommodation is for med-surg, telemetry, intensive care. DNR would be flagged if the patient had a current do not resuscitate or Pennsylvania orders for life-sustaining treatment. The to sign column is a column unit clerks generally don't use. A green flag tells me somebody else has something to sign. The information desk column is currently being used to determine visitor status for COVID patients. Our second tab is orders. These are the orders that are currently active in Sunrise. They're displayed in a department display format, such as lab, medications, cardiology, nursing, dietary. Take note of the status column. This is telling you if these orders are still active and pending, or maybe they've already been performed, canceled, or discontinued. On the left is an options panel. These are various filters that you can change based on what you need to display. This chart is this particular visit for our patient. All available charts anytime this patient has ever been to Jefferson Northeast. If you make any changes in any filters, your reset icon will become active, and this will reset all your filters, taking you back to your defaults. The status priority of current means I'm only seeing the active current orders. If you would like to see orders that are no longer current, such as discontinued or completed orders, changing that option to no status priority filter will show you all of those orders. Note that active orders are bold and italicized. Inactive orders are not bold. I'll reset my filters so I'm only seeing the active and current orders. If you have a pending lab that needs to be collected and sent to the lab, you can perform this function by checking off the order, selecting the icon Add Specimen, or by right-clicking and selecting the option to Add Specimen. The Add Specimen window displays, which does require a start date and a start time. Using the large arrow here will open up a calendar. Today's date is circled, and then I would type in my start time. Select OK. These warnings are because we're in a training system and we're not using active patients. We're not actively communicating with the lab. I'm just going to OK through that. We're also not actually printing anything. I'm going to OK through that warning. You would not normally see these warnings. I no longer have a pending urinalysis because it is not in active order. If you need additional information about any other order, I'll right-click over the order, select the word View, and there are multiple options you can view. Expert advice on aspirin would allow me to see pharmacology, side effects, different generic and brand names. Other options that I can right-click to view: history, if this order had been modified or changed at any point. Order details would show me the original order form. I can see who ordered this, and if there's any special instructions, that's generally more toward the bottom. The next tab is results. Results for this patient will display for the last 3 days. Again, you have the options and filters and you can change these dates. I'm going to go back a couple years ago to find some results for this patient. You'll see flags in the results columns. A green flag indicates a normal number. A red flag is an abnormal number. And the yellow flag is a text or a typed up report. To view one result, double-click over one flag. The expand icon will open up the actual report reading. To return to the original view, display view of summary takes me back to this original summary grid. If I want to see everything in a particular category, I would highlight the category and everything would display. Again, back to summary. Maybe I want everything for a particular date. I would highlight the date. And again, I'll go back to summary. The next tab in our patient's chart is patient info. Items on the left menu allow me to view different parts of the patient's chart. The alerts are for the physicians. Allergies and intolerances can be viewed here as well as in your patient header. Comments is where you will find insurance information. If a patient has Medicare insurance listed here, the patient will need to sign a form stating that they are aware of their rights as a patient. This form needs to be signed within 48 hours of admission and also within 48 hours of discharge. If the patient has additional questions concerning the Medicare form, or if they are unable to sign or unable to communicate with you, you can contact care management and they will assist with getting that form signed. Once the form is signed, the patient receives a copy and the other copy gets placed on the patient's chart. Care providers will list the patient's admitting physician and attending physician, as well as their PCP any consulting physicians, and their care management or social worker. Health issues is their problem list. Diagnosis, past medical history, any procedures performed, and family history. Significant events list advanced directive information, or if the patient has ever had a code or rapid response, that is also listed as a significant event. Address, phone, and contacts. The patient's emergency contact will be listed here. Demographics is their address, employer, and visit history will show you every time the patient has been here and their visit reason. We don't use the data entry section here. The next tab is documents. Here you'll find all of the clinician's notes, the physician notes, the nursing notes, physical therapy, and care management. A single click on the note will open the note on the right-hand side. You can also double click to open it in a larger window. Unit clerks are responsible to make sure that the admission history and physical has been either completed by the attending or co-signed by the attending physician. You can open the status tab to see who authored or completed the note and if the signature by the attending physician is still pending. The clinical summary tab is a summary of your patient's chart. You have different views to choose as your default. The physician view is a nice summary listing allergies, care providers, visit history, health issues, orders, results, as well as vital signs and medication orders. This can be saved as your default by selecting the icon Save Display Format, Save as Default View. While working in any tabs of your patient's chart, you can use the icons Previous and Next Patient to scroll through other patient charts. For example, if I'm viewing the orders on Claudette, now I can switch to Joan Crawford's chart and Betty Davis's chart, and so on. Back to the patient list, back to my home page. Some additional icons on the toolbar include a refresh icon. Sunrise does not auto refresh. If you're in the system for any length of time, always a good idea to refresh your screen. The next two icons, Find Patient and Find Visit, allow you to search for a patient who is not on your list. Find Patient is generally used as an outpatient search, and Find Visit is a little bit quicker if you know the patient is an inpatient. To use either of these, as long as you know a last name or an ID number, you'll be able to locate the patient. I'm going to look for the patient with the last name of Kirk. I can then hit enter on my keyboard or search. And James T. Kirk, I can find him. He is at Tarsdale 3A in room 3351. To work with Mr. Kirk's chart, I will highlight, double click, and I can now open his chart, such as his orders, results, documents, and so on. This generated a temporary list. Temporary lists are located at the bottom of your menu, and they will be removed once you log out of the system. I'm going to go back to Frankfurt 5 East, and I'll select another patient. The allergy summary. I can see my allergies listed here. I can also see the allergies listed here. Unit clerks do have the ability to enter allergies if needed. This is generally done by the nurse or the physician. But if you need to add an allergy, select the Add New button at the bottom of the screen and then enter new allergy. Anytime you see red stars, those are your mandatory fields. Everything else is optional. I'm going to enter an allergy for this patient. Reactions, there are several, or the option for unknown. As long as those red fields have been satisfied, I can say okay. This allergy is now listed in the system and will display in the patient header area. We'll come back to the work list manager. The next icon we'll look at is the printer, print reports. Change this report category based on what you need to print out. For example, if you were printing results, there's a category. If you're printing orders, there's a category. If you need to print documents, that's under documentation. To print a list of your patients for that unit, that category is nursing forms. This is a category you will use every day. A nursing unit worksheet will display all patients on your currently listed unit. The icon Change Location is used by the nursing staff to move the patient to the operating room if necessary. This is done by selecting New Location and then Operating Room. You can see the patient is listed now in the Frankfurt operating room. The icon for More Header Info is another way to view the patient's length of stay, visit status, admission date, and time. It's also active care providers can be viewed here. The Missogram wrench is a miscellaneous icon that takes you to the intranet. Here you have a couple options to send messages to other units for stock on your particular unit. I'll do a miscellaneous. You need to fill in where you're coming from and who are you sending the message to. SPD is our supply and purchasing department. Other items you might find useful here under nursing information. There's a list of care management's phone numbers. There's a list of translators' phone numbers. And physician phone numbers can be found by searching here. The icon Drug Info allows you to search up pharmacology and side effects on many different drugs. Health issues is another way to view your patient's problem list, including diagnosis, past medical history, and family history. There's one other icon sitting here on the left next to your patient's name. This is how you can enter orders for your patient. The patient's name is listed at the top of the order entry worksheet. And it's stated requested by me, the unit clerk. What types of items can you order? You can send messages to other departments about this patient, and you can order individual patient supplies here. The date and time are defaulted. You have the option of the start a browse, browsing through these departments. And your other option is manual entry. I'm going to order an ACE bandage for this patient. Under manual entry, I'm going to type ACE. And you see we have several options here. Highlight and add to the right or double click, and it drops down to your lower window. I can edit the quantity by highlighting the order and selecting edit. The other option for finding an order is by using the Start a Browse. I will go down to SPD, again, the Supply and Purchasing Department, and find an ACE bandage here. You can also send messages to departments about this individual patient. Admissions, if there's a bed status change, if the patient is being discharged or being transferred, I would leave the message here. Select Submit Orders when finished. This error, again, is because we are in a training system. You can view all orders, again, on the Orders tab. There's the ACE bandage, and there's that admission message. You can enter tasks to remind all unit clerks that they need to complete the Medicare form for patients, as well as checking the admission history and physical document to make sure it has been completed and co-signed. To create those reminders or tasks, that's done also through this icon, the Enter Order icon. Once these orders are submitted, they will generate a task. All new admissions will require the history and physical checklist task. And if the patient has Medicare insurance, all new admissions will require the admission notification and the discharge notification. I will submit those orders. Those orders are listed under the Department of Nursing. Those orders have now generated a task in the last icon up here that we kind of skipped over earlier, the Work List Manager. If other patients had tasks on this unit as well, they would also be listed here. Currently, only Eve has 2 tasks for us to complete. The Work List Manager is set up for unit clerks, and it is defaulting to today's date and time. You can change these times if needed. The history and physical checklist, to complete this task, I'll select my current time, which is listed here. Again, this can be changed if needed. And then I will answer these 3 questions. Was the history and physical completed? Was it dated, timed, and signed? And then did the attending physician also date, time, and sign it? If the answer is no, you would leave this task generate for the next couple days until that admission physician signs off the history and physical. Notice it is no longer yellow. It is no longer a task for me to complete today. The Medicare notification also needs to be completed. This patient does have Medicare insurance. Again, I can change the time if needed. Was the notification signed? If it were not signed, you would state a reason. And any comments can be free texted here, again, if needed. Once I'm finished, I will close the work list manager. Those orders are no longer active for this patient because I stated that the history and physical had been signed and the Medicare form had been signed. To remove any unit clerk orders, you can right-click over the order and select complete. The last item needed to be reviewed is in case of a computer downtime. If the Sunrise system has a downtime, physicians are allowed to write their patient orders. Once the system is back up working, the unit clerk or the nurse or the physician can re-enter those written orders. To do that, it's the same icon, the enter order icon. But instead of requested by me, the unit clerk, I would say requested by other. Some of the physicians may be listed here. If the physician who wrote those particular orders is not listed, you can search for them by saying requested by other. Select the appropriate physician. The source for unit clerks would always be the first 01 written. These are written orders. Now that the physician's name is listed on the order entry worksheet, you have the ability to enter physician orders, such as EKGs, consults, x-rays. Again, you can use the browse and browse through these different departments or manual entry. If I need to order a chest x-ray, I can type chest, or I can type CXR. The blue icon to the left tells me that there is a form associated with this order that I need to fill out some additional information. I'm going to order a chest x-ray, PA and lateral. Again, double click or highlight and add. And the red fields are mandatory. You can type in these fields, or you can pick from the drop-down menu. Patient handling, how are they going to get to the chest x-ray? Every order form has a free text if you need to add some additional information. Those are not mandatory. As long as those red starred fields have been satisfied, we can okay that order. Once your orders have been finished, again, we'll submit the orders for the patient. Going to the Orders tab. There's that chest x-ray, and there's the EKG order that was just placed. Depending on your orientation schedule, you may be coming to the hospital to work on some practice exercises. The Sunrise trainer will be available there to answer any of your questions. If you need any additional assistance, please contact the help desk at 215-612-4026.